mask, not wearing one, and both parties conducting commerce and supporting the economy in peace. However, when returning home to the Tampa Bay area, I witnessed anger, vulgarity, and division. Many loyal customers stormed out of businesses never to return. These small scrimmages many times go unreported to the police and therefore do not show in statistics. In this time of great divide in our nation, the last thing we need is another wedge to divide us even more. I'm not here to debate the effectiveness of the mask, only the liberty of use. The fact that there are at least 2 lawsuits, numerous complaints, and angry people all throughout the county threatening violence proves that this is a bad idea and not a true representation of the voters that are represented. To summarize, I would like to ask that the group and the mandate be rescinded and the free citizens of the Hillsborough County be allowed to make their own medical decisions and conduct commerce in harmony. Liberty is the soul's right to breathe, and when it cannot take a long breath, laws are girdled too tight. Henry Ward Beecher. Remember, rescind equals re-election. Thank you for allowing me to speak.
Keisha Katsaris, I think that's how it's pronounced. Keisha, last name is spelled Katsares. Did she drop off? Okay, we'll move to the next speaker. Jennifer Cantor.
Hi, my name is Jennifer Cantor. Thank you for having me here to speak. I have 2 things that I'd like to address with you today. First is a little bit of public awareness for the general audience listening, more so than you guys, because I'm pretty sure you guys are mostly all aware. Our community is taking this crisis very seriously, and our public servants are taking this crisis very seriously. I do not think that the average member of the community is even slightly aware of how much you guys have been doing behind the scenes in order to make everything that needs to happen work to help keep our community safe and healthy. Right now, my husband, who is a librarian, is in the County Emergency Operations Center learning how to do work to support the EOC. I think that the average citizen has no idea the lengths that you guys have been going to try to mitigate the situation. And I think everything that your communications department has done to try to help spread that word, because I think that a lot of people don't realize exactly how serious the situation is and how much is being done behind the scenes. So I want to thank the folks that have very nimbly, from all departments across county. I know employees in several departments who have gone to alternate assignments and done tasks that have nothing to do with their normal work and are part of their emergency assignments. And so thank you, and I hope you guys are thanking them for the work that they're doing. I also would like to take a moment to remind you that for every caller that you get who says that masks hurt businesses and that they're hearing complaints from people, they're not hearing those of us that appreciate the safety and security masks provide, who walk out of their stores and never come back. So when they see their businesses failing and folks not coming back.
Thank you, Ms. Cantor. Your time is up.
Those of us who wanted the mask.
Thank you, ma'am. Your time is up. Thank you. Catherine Palmer.
I am Catherine Palmer. I am here today to support the mandatory face coverings to slow the spread of COVID-19. As our elected leaders, we have placed faith in your decisions and actions to safeguard and promote the general welfare of the citizens of Hillsborough County. I, as well as many others, trust your judgment, founded upon the basis of science and knowledge of your experts in many fields. These experts, continually updating their data, keep saying these 3 things: wear masks, wash your hands, stay at home as much as possible. My daughter and I work in the convention part of hospitality. We have been out of work since March and will remain out of work until the numbers drop and public confidence comes back and safety in numbers can be assured. While some of the general public think this is over, those groups that hold conventions and banquets disagree, and as such, a portion of our economy continues to be shut down. We would rather that such precautions as wearing masks stay implemented until the numbers drop to ensure an eventual return. Please do not barrel forward because of a promise or a plan. Such promises or plans don't matter to the invisible destroyer that COVID-19 is. By saying this, I acknowledge that doing the right thing can create hospitality and unpopularity. But based upon your experience, knowledge, and data, I am sure you will do what is right for our future. That your decisions are based upon fact and data, not politics, short-sightedness, and selfishness. Life is full of hard choices, and many of those come from doing the right thing. We are in hard times, caught between decisions that are the difference between life and death, and this is the crux of your work. But in the end, if you can look in the mirror and say, well done, I have attempted to save many, I will stand with you. And if your decisions call for stricter measures to ensure our tomorrows, I will stand with you so that we may emerge from all this with a sense of safety to move ahead. Thank you for all that you do.
Jason Kimball.
Hey guys. So I appreciate the 3 no votes last Monday. I'm glad we have people who see the lack of scientific evidence and who respect the Constitution. But Commissioner Merman, Vice Mayor Ross, Hillsborough really needs you guys to vote no. Do not allow yourselves to be influenced any longer by the tyrannical radicals in this group. They are truly radicals. They are blindly, obstinately supporting mask mandates with no scientific evidence for no reason other than political gain. It has now been 3 weeks, so we won't get a wise answer from the experts about how there's a 2-week incubation period. It's been 3 weeks. There have been no results. The mask mandates have done nothing to curb new case numbers because face coverings are totally ineffective. You're dealing with doctors who are obsessed with the spread of the contagion, but focusing on that has been futile, as widely predicted. The EPG experts should be following the science and focusing on immunity, but they don't. They have high occupancy at their hospitals. They parade their occupancy numbers in front of the EPG like they paraded their deceased patients. In reality, those numbers are because of their treatment protocols. They have nothing to do with masks. We don't have the entire United States saying, oh, look at Tampa, look at the incredible results they're having there. Those aren't the doctors you're bringing on. The doctors coming on today, just like the previous times, have no evidence to support mask mandates. I've listened, you've listened, we've all listened to what they have to offer in terms of evidence of mask effectiveness, and it simply doesn't exist. So we have to stop killing our community. Ultimately, you guys are not rulers. You're accountable to the people, and I'm telling you, especially Vice Mayor Ross and Commissioner Merman, that people will hold you accountable come Election Day. The radicals won't be there to protect you in the future. They only need you now. You think the majority of Hillsborough citizens approve of what you're doing? You're wrong, Commissioner Merman. They don't. Do not allow this emergency policy group to dissolve in shame. Do not do the mask mandate.
Thank you. Thank you very much. Thank you. Thank you.
He needs to not attack us personally.
Commissioner Merman, you're right. I think that's the same guy I had the conversation with last week. That's why I changed and brought forth a statement asking him not to do that. And he just doesn't get it. And I'll be watching for that name again next time we have a meeting.
Thank you.
You're welcome. That's my fault. I should have stopped him immediately. I apologize for that. I apologize.
Okay.
Leslie Forrester.
My name is Leslie Forrester, and I live and own a now paused business here in Hillsborough County. Thank you to the entire EPG for their diligent efforts to ensure the health and safety of our community. In the absence of consistent, evidence-based policies and actions at the national and statewide level, we depend on you to make wise decisions and mandates for us. Help us, Obi-Wan. You're our only hope, so to speak. And we badly need help. As of yesterday, the Johns Hopkins data lists our county as the 4th worst in Florida and number 30 in the entire country in confirmed cases. And confirmed cases equals community spread. Current data does not reflect now. It reflects the spread and behaviors of 3 to 4 weeks ago. I have an older loved one who was strictly sheltering in place, but went to the doctors on June 24th. Then got a phone call on the 26th asking them to be tested. Someone working in the office had tested positive. The first local appointment wasn't available until the 9th of July, and they were told they would get results in 5 to 10 days. Still waiting. I encourage you to look at where you would like to see us in 3 weeks and take action now, setting benchmarks in the data to make real and significant changes. You've led us all into the room where it happens, but listening to you relitigate the good, necessary first step of our mask order every week, it steals the time you need to move on to the vital second and third steps. Why not say now that the mask order will be in place until we reach the CDC recommended average of 5% positive? Why not say now when ICU capacity reaches a rolling average of 90% that we need to close down non-essential indoor spaces where it is necessary to remove masks, taking indoor dining back to carry-out only? How bad do we have to be to see us roll back to a full shelter in place? Decide now, based on science and data and not politics. Only controlling the spread of COVID will allow us to go back to normal. I thank you for your time.
Thank you. Paul Thompson.
Hi, this is Paul Thompson. Thank you for having me. I'm actually here with some good news and to talk a little bit about the statistics. Firstly, I assume most of you have seen that the Hillsborough percent positive dropped today to 12%, which is the lowest it's been in weeks, which is great news. I want to talk a little about the media. Yesterday, we saw the news media show what it looks like when the data is reported unbalanced. I'm sure everybody saw Florida get slammed for the Sunday's data of 15,000 cases. Almost none of them mentioned that we did 142,000 tests that day that was reported. That's 142,000. That is just an astronomical amount of tests for a single day. And that's triple what we had done just days earlier. So that really needs to be taken into account. The media also failed to mention that Florida, Hillsborough, and Pinellas all had their percent positivity plummet for the last several days in a row. I think each one of them 4 days in a row, 11 and 12% for Florida and Hillsborough, and Pinellas has been in the single digits at 7% for the last several days. The medical team presenting on these calls has actually been much more balanced than the media, and I want to thank Dr. Holt and the medical team for presenting a balanced picture. I would encourage, though, anytime we talk about the case count, to please include the number of tests. Just discussing the cases without saying bleeding. If the cases have gone up 60%, please say that the number of tests for the same day went up 100% or 200%, because that's really what's been happening. I would also love to see an increased focus on the percent positivity. Again, we've been at a 12% or so for Hillsborough for the last several days. And in today's presentation, I would love to see the focus be on how well we have been doing in bringing that percent positivity, because I think like last week's presentation showed more like 20%, and we've actually been doing very, very well for the last couple of days. So hopefully we can see those numbers. Thank you for your time. I appreciate everything that you all do.
Bella Elwell.
Thank you, Mr. Chairman. My name is Bella Elwell, and I'm a college student in Hillsborough County. At this time in my life, I'm more concerned about the future of myself and my generation than I am of getting COVID-19. This mask mandate exempts government officials and offices in stating that you trust them to create their own policies. Why do you trust your own government people and not the people who put you in office? Why do you feel I'm not trustworthy enough to make my own decisions? How can you trust others in government to do the right thing for the health of the people and not trust the people who elected you? This mandate needs to be removed, or at the very least, amended to be the same recommendation for the people that you gave to your government coworkers. It's bad enough that this EPG is not a true representative body, and my commissioner has no say in these pretend laws. But now you've created a system where the government operates under separate rules and separate laws, and that is not what America was built on. The Florida Constitution demands equal application under the law for all people. You need to stop violating our Constitution. You need to trust the people who have elected you, and you need to repeal this order or make it voluntary for the people like you've made it for the government. Thank you.
That was our last speaker. Let me apologize to Commissioner Merman and Mayor Ross for not intervening when the gentleman was saying some things to you. I did that last week. when the person, I think it was the same gentleman, started to attack some other members of the commission. That's why I came back today and developed this public comment notice that I read before the public comment, which says, however, it is requested at the same time when you address the EPG members that comments are not directed personally against an EPG member, a staff member, or presenter. And I'm hoping that everyone out there that's listening right now, that I'm going to read this at every meeting, and those of you who want to attack either an EPG member or a staff member or presenter, I will ask you to be cut off. I will ask you to be cut off. We respect you when you have your comments. No one interrupts you. When you start attacking the members, then I will ask you to please not do that. And if you continue, I will ask you to be cut off, because that's not how it should be handled. And again, Commissioner Merman and Mayor Ross, I apologize.
Thank you.
Thank you, Commissioner.
You're welcome, sir. You're welcome, Commissioner Merman. Emergency Management Update, Mr. Tim Dudley.
Good afternoon. Teams continue to work hard behind the scenes to conduct emergency operations. Total tested last week, 10,448. Our Brandon site will be increasing capacity. It will conduct 800 tests per week, up from 300 per week. And I'd like to thank that staff out there for making the adjustment. Our Town and Country site will be online this Friday, 17th of July, working with our partners at Tampa Family Health Center. So we'd like to welcome them to the operation, and we look forward to working with them. Logistics. There were 93,750 cloth masks distributed by the county library teams. So I'd like to thank those teams, and I'd like to thank the caller for calling in and recognizing some of our folks that are working hard behind the scenes. I appreciate the comments, and I'm sure that the team does as well. In logistics, we're working with the supervisor of elections to submit requests to the state for surgical masks, wipes, and hand sanitizers. The acquisition of these supplies will ensure that personal protection is in place prior to elections. We have 0 guests in quarantine and 29 guests in isolation. This concludes my update. Any questions?
Thank you, Mr. Dudley. And I don't see any questions. Again, thank you very much for all that you do.
Thank you,
Dr.
Mr.
Holt.
Chair.
You're welcome, sir. Dr. Holt, Public Health Update.
Yes, sir. This is Dr. Holt, Florida Department of Health, Hillsborough County. We will be presenting the epidemiological and hospital data. I'll be doing my high-level observations with Mr. Wagner providing the detailed graphs that he prepares for us. Second slide, Mr. Wagner. So as of this morning, we have 19,828 confirmed cases of COVID-19. That's an increase of 658 from yesterday, the number you see, 19,150. I would note that this trend has continued to show some slowing. Overall, 1.28% of our total population has tested positive. We've had 188 deaths, which represent 0.01% again of the total population. The estimated number of recovered individuals here has not been updated. My estimate, and we'll revise this, is around 3,100 as of today. Looking closer at the 14-day trajectories, our most recent 14-day has averaged 658 cases per day. This doesn't represent an increase from the prior 14 days of 42%. But as you look closer at the 7-day trend, there is significant flattening that has been sustained. So again, I'm encouraged that our community-wide efforts are beginning to show some impact. Our test rolling 14-day test result is above our target, and it's continued to increase. A rough estimate, we've increased that about probably 20% since 14 days ago. Positivity, as we've noted, this has also beginning to show a sustained decrease. While our 14-day calculation is 20% here, if you look closer at the last 7 days, it's been 15, and as noted, the last 3 days, it's been averaging around 12.5, both an encouraging trend. So our COVID-19 transmission appears to have stabilized. I think the efforts that the governor has done with targeted closures and seeing more community cooperation with our social distancing and other, and including the mask use. If we can keep this up, I expect to begin to see an actual downtrend rather than just slowing. Let's look at our hospitalizations. The hospitals remain very busy, but they have not approached what I would call a critical stage that we have seen some other counties in the state. There's been 437 average number of hospitalized patients with COVID per day for the past 7 days on average. Our total bed occupancy is below 80%, and has decreased 2% in the past 7 days, both positive trends. Our ICU bed occupancy exceeds 80%, but we've again noticed a slight decrease daily over the past 7-day period of 3%. The admissions continue to increase. We now have an average of 69 over the last 7-day period. Would note, looking closer at the admissions for our long-term care facilities, which I had mentioned previously, I do continue to see an increase. In the past week, we had 81, and that's a significant and steady noticeable increase over the past several weeks. I think that reflects mostly, again, aggressive testing in our long-term care facilities. Our deaths updated, we have 188 Hillsborough County residents that have died of COVID-19. Would note that the overall percentage of those who've been infected or those who have tested, and we've confirmed that the total number, our percentage of deaths is around 1%, which, as I think Dean Lockwood has mentioned several times, continues to be below the overall state and the rest of the country. I'll stop there and then ask Kevin to proceed with his graphs.
Thank you, Dr. Holt. Again, Kevin Wagner, business analyst for the Healthcare Services Department. As of, again, this morning, it's nearly 20,000 cases on the aggregate for Hillsborough County. The majority, again, are still women. Around 52 to 53% of the cases are women, to men 47 and 46%, or 48% respectively. To date, we've tested over an estimated 11% of the population. Is probably closer to 12%, as of with today's number factored in respectively. But again, about 12%. Looking at the age breakdown on the aggregate, we are still seeing the highest of the entire event in the 25 to 34 age range and the 15 to 24 age range. But really, the next slide is the one that's going to tell the interesting story. What we're seeing, while in those age groups are still the highest on the aggregate, we're seeing a downward trend of the positive percentages in those age groups in the green bars indicated, for 15 to 24 and 25 to 34 in the 7-day periods. Those are trending downward. the observation really is, if there's a downward, where is the upward? Respectfully, that's occurring in the age groups 35 to 44, 45 plus, and 55 plus, and 65 plus. So while the younger population is trending downward, the older population is trending in the wrong direction. And then, as Commissioner Overmans noted a number of times, the under 14 age group is also trending upward. So while one group is getting better after the July 4th holiday, based upon the 7-day average of July 12th, the other groups are getting more infected. So again, we're trying to see that balance, and now we're almost looking at these green bars almost in a standard bell curve on the 7-12 data, respectfully. Looking at the cases per day, and the yellow bar again are the 14-day cases per day. On 7/11, there were 790, and again, we keep up with this every day. But again, we are slowly seeing a flattening. We anticipate a flattening around 650 to 680 on 7-day averages, respectfully. So we hope to see this start trending to be plateauing and then decreasing. With regard to testing, as Dr. Holt indicated, testing results are above the estimated from Dr. Lockwood at USF of 2250. Again, the 7-day average is nearly 3,300 test results on the FDOH daily report. So again, those test results are doing well in that component. Speaking to what the caller referenced, he actually referenced something that we were going to speak to today. We do show that 20% of the positivity of the daily results. But again, that is the daily results as reported from FDOH. What is on the other end of the spectrum on the caller was the dealing with the testing and the positivity of those testing percentages as they're reported. So our plan, when speaking with Dr. Holt a couple hours ago, was to remove this slide and adjust it down, or adjust it appropriately with more of a testing focused and a testing positivity percentage, where you'll see a daily average of around 12%, but a 14-day average of the testing around 16%. While these green bars show just the daily results as reported, the testing component is the other one we're going to focus on. So we're going to slide this one out and put that one in respectfully. Hospitalizations, again, the trend has been upward, and we're seeing, a admits somewhat of a flattening, but no more increasing of the hospital admits on the previous day. On July 10th, as reported, 79, previously 68, and the lower 60s. So we hope this is flattening and not increasing of the hospital admits. But again, this is one of the concerns with the hospitalizations that we're seeing, that the 7-day average is nearly 70. So again, we hope to see this trending downward or flattening for hospital capacity. Again, when we look at total hospital bed utilization, this is the concern, where there is a steady increase. On July 10th, nearly 506 beds of the census were individuals for COVID. A vast majority, 417, were in non-ICU beds, while the remaining 89 were in ICU beds. So again, this has increased respectfully. We hope the hospitalizations flatten, but the current trend is going slightly upward. So again, that is what we're trying to monitor from the hospitalizations and the overall capacity in that regard. Individuals presenting at the ED, at the emergency department, I believe this was presented last Thursday. But again, on July 5th, there was 1,115, slightly downward from the previous week of 1,311 in illness presented at the ED department. Again, we hope this is a trend downward or a trend flattening. These two particular weeks did see a 15% decrease in ED visits on those respective weeks. And I'll stop there. Thank you.
Okay. Anything further, Dr. Holt?
No, sir.
Okay. We have some hands up for questions. Commissioner Merman, you recognize.
Oh, I just wanted to thank everybody, especially Tim Dudley and Dr. Holt, for opening up the site in Town and Country. Really appreciate the residents have been asking for that. And thankfully, we've got the great partnership with Tampa Family Health Center out there. It's a newly opened facility, and I think the residents will really appreciate. There's a lot of residents up in that community. Thank you.
Ms. Snively, you recognize.
Thank you, Mr. Chair. First, I just want to go on record and say that I've actually been here since about 1:35 p.m. During public comment, I was able to connect. So just want to put that on the record that I am here. And then a question on slide 12. Could we possibly add the data that to slide 12, which shows the hospital ED visits? Could we also add to that the actual admissions? Maybe another line on that graph that shows the visits compared to the actual admissions to the hospital. Is that a possibility, please?
I will work with Dr. Holt to determine if that's possible.
Okay, I wasn't sure if that information is available to us or not, but I think that would be helpful to see the comparison. So thank you, gentlemen, for your report.
Thank you.
Okay, I don't see any more hands, so thank you very much, Dr. Holt and Mr. Wagner. Appreciate it very much. Ms. Beck, County Attorney update.
Yes, good afternoon, EPG board members, Chair Miller, Christine Beck, County Attorney. The item on this update is the review of the face covering order, and I'll just remind you that you all had voted to have this order reviewed every 7 days. That's why it's on the agenda. At this time, Mr. Chair, it'd be appropriate to entertain discussion or motions relative to that order.
Is there a motion?
Move approval.
Motion by Commissioner Overman. Is there a second? Is there a second? I will pass the gavel to Commissioner Merman, and I will second the motion. Commissioner Merman, you carry the meeting now.
Okay. Is there any comments? I don't see any hands.
Ms. Snively hand up.
Okay, Ms. Snively, you're recognized.
Sorry, I meant to put my hand down. Sorry about that.
Okay.
Any other hands up?
No.
I want to make a comment because I think it's important to continue the mask policy at this point. The numbers are all going up. We are making these decisions completely on data from our health experts. I know a lot of people out there dispute that, but it is scientific and it is data that's given to ACA, which is our state agency. So I think it's imperative upon us to keep going until we see these numbers go down and we know that people are safe in our community. And is there any further discussion?
I don't see any hands.
Okay, then call the roll, please. Thank you.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Cronister?
No.
Castor?
Yes.
Ross?
Yes.
Lott?
No.
Snively?
No.
Great. Motion carried 5-3. Sheriff Cronister, Mayor Lott, and Ms. Snively voted no.
Okay, thank you. I'll take the chair back from Commissioner Merman now.
Thank you.
Thank you. Is there anything further we need to discuss today? Anything further we need to discuss at this point? Anything further we need to discuss at this point? Commissioner Merman, you recognize.
Just one quick question. Do you think we're at a point where we should need to continue to meet twice a week? I mean, have you given that any thought, Mr. Chair?
I had given it thought some toward the end of the week, last week, when it appears that our numbers may be somewhat flattening. However, in the past couple of weeks, even though it seemed to be somewhat stabilizing, it's still higher than the ones we had a couple of weeks ago. And then this past weekend and today, statewide, we shattered records. So that's my opinion, but this body would have to be the one to determine if they want to continue to meet twice a week or once a week. So we can have that discussion at this point. Anyone want to discuss that? Mayor Castro, you recognize.
Thank you, Chair. My opinion is that we need to continue to meet twice a week to provide the community with the information, but I would be in favor of having a Monday meeting that is nothing other than presentations, to have the information that is provided by the experts, by Mr. Dudley, by Dr. Holt, by Mr. Wagner, to have that information that is important to our residents. And then on Thursday, have more of an open discussion, because these are very time consuming. I'm quite certain for the county's administration to put them together. But I do believe that our communities, various communities, depend on the information that is provided by this emergency policy group. So I would vote in favor of continuing the twice a week until we've seen some dramatic downturn. We're out of the woods on this COVID-19 issue. To have a shortened Monday meeting with presentations, and then on Thursday, the open discussion. Thank you.
Okay. All right. Commissioner Overman, you recognize.
Thank you, Chair. I just wanted to publicly say thank you to not only our staff, but everyone that's working on fighting this virus as it continues to spread across our communities. And thank those that are being part of the solution. We have a lot of companies, a lot of businesses that are working very hard to enforce our executive order that employees wear masks or face coverings in order to fight the spread. We have an order in place that allows for masks to be legally worn, and it's fine to do so. And we have a lot of our citizens that are making a difference, which is why we've seen some improvement in our numbers. But that doesn't mean we stop. And so the diligence that our community is doing, I just want to say thank you, and keep doing the great things to help us get back on track, because our healthcare workers need it, our kids need it, our elders need it, and our businesses need it. So thank you so very much.
Okay. Commissioner Merman, your hand's up again.
Thank you, Mr. Chair, and thank you, Mayor Castor. That's exactly what I was getting to. If we could have an abbreviated meeting on Monday and then go into more of a heavier discussion on Thursday, I think that would be very beneficial. But I think you're right. Until these numbers go down, citizens want information. So that's where we're at. Thank you.
Okay, is there anything further we need to discuss today? Anything further we need to discuss today twice? Ms. Snibe, you recognize.
Thank you, Mr. Chair. Just a quick update. I'm hoping that the information I share with regard to the school district is helpful to the members of the EPG in answering some of the questions that they might be receiving from the community and their constituents. But we do have this week another workshop with the school board and the superintendent and his staff to discuss the reopening of schools and to try and answer as many questions as possible so that parents can make their decision on whether or not to send their children back to school. And I also, we are hosting the Department of Education, the Florida Department of Education board meeting. We'll be coming to Hillsborough County to Strawberry Crest High School this week to host the meeting, and hopefully we'll have some more information coming out of that meeting as well to share with constituents on Thursday. So thank you, as always, for allowing me to interject some comments about the school district. I appreciate the time.
You're welcome. Is there any further discussion on any topic at this point? Going twice? Going thrice. Thank you. Everyone have a great remainder of the day, and we'll meet again on Thursday. We adjourn.
Thanks, Chair.
Thank you.
Thank you.
Thank you.